Shantel Irwin. I'm the CEO of Arthritis Action, and welcome to our webinar on COVID-19 and arthritis, a live Q&A. I'm joined here by Dr. Wendy Holden, our medical advisor and consultant rheumatologist, who will be answering some of the most frequently asked questions about coronavirus and arthritis. How are you today, Wendy?
I'm great, thank you. It's good to know there's lots of people out there. I wish I could see a few, but it's nice to know you're there anyway. So hopefully today we're going to cover all things COVID related, especially general health questions to do with arthritis. And then we're going to cover lots of different topics based on your questions, including living with arthritis. Can I just make my screen go a little bit smaller? Sorry, I have a technical challenge there. My script has disappeared from the screen. I'm just going to attempt to make my screen go a little bit smaller. Okay, sorry about that. So we're going to talk about general health, work and arthritis, medication and immunosuppression, exercising in isolation and out of isolation, and talk about things like loneliness and mental health issues. Now, the first thing to say, a question that we're asked most commonly is about shielding at the moment, and advice is rapidly changing. So the latest advice changed on the 31st of May, and we're expecting further news this week from the government on what to do next. So as soon as this advice comes out, we're going to be publishing it on our website, and we'll be discussing the current advice as we go along. So watch this space, really.
Great, thanks, Wendy. And thanks to all the attendees who have submitted questions beforehand. We'll be responding to those today. If you have any further questions during the webinar, please click on the Q&A button that you'll see at the bottom of the screen and type in your question, and we'll answer them later in the webinar. If we don't have time to answer all your questions, then we'll be sure to email you after the webinar has finished with some answers. We'll be sending an email to you with more resources and information after the webinar as well. So without further ado, we'll jump right into the questions. So the first set of questions, Wendy, focus on general health and arthritis and COVID-19. So the first one is, am I at increased risk of catching COVID-19 because I have arthritis?
Yeah, that's a really good question. So the simple answer to that is no. Just having arthritis doesn't mean that you're at increased risk of catching COVID-19. And people taking immunosuppressive drugs are not necessarily at increased risk of catching COVID-19 either. Now, the important thing, however, is if you should catch COVID-19 and are taking immunosuppressive drugs, you may be at increased risk of complications. And the British Society for Rheumatology have developed guidelines that are on their website regarding shielding, and they have put people into 3 different risk categories according to what medication they are taking. So it's slightly confusing, the advice, and it generally needs to be applied to each individual, but there are some broad guidelines on their website that can be really helpful and can help you if you're confused.
Excellent. Can I still contact healthcare professionals during lockdown if I have any health questions or concerns?
Yes, absolutely. We are still working, although we're doing it in a very different way, as you've probably gathered. So most GPs are doing all or most consultations by either telephone or by video, but they're seeing emergency people, of course, if they still need to. Most rheumatology departments are still functioning, albeit in a slightly different way. So most departments are still operating a nurse-led advice line, and lots of consultations are still being done by telephone and sometimes by video as well. However, we have heard that some departments have unfortunately had to shut down, however, completely. This wasn't really supposed to happen, but lots of doctors do general medical duties as well. So they've been taken away to look after people who've been affected by COVID. So we would really like you to contact us if this has been your experience, if your department has completely shut down, because that wasn't meant to happen. And the Arthritis and Musculoskeletal Alliance, otherwise known as ARMA, Shan will explain what this is, are gathering these informations to try and do some lobbying.
Yes, so we're a member of ARMA as well as many other members who are part of the MSK community. And ARMA are meeting with Public Health England, NHS England, and government on our behalf to make sure that we're all speaking to them with one voice. So again, please do share any concerns you have or any services that should be up and running but aren't yet, so that we can feed that back in and we can help get everything going again for you all. What should I do if I have a flare of my arthritis?
Okay, so please contact your rheumatology department as usual, and they may still see you if you are having an emergency, if it's safe for you to come up to the hospital. Or what's happening to lots of people is that they've been offered emergency prescriptions of some steroid medicine just to get them through a temporary blip or a crisis. So some people used to have steroid injections which have temporarily been suspended for a while, but there's lots that we can do to help, so please keep contacting us.
I have arthritis, but I don't take any medication for it. Do I need to shield?
If you're not taking any immunosuppressive medicines and you don't have any of the other conditions that might make you vulnerable to COVID, then you don't need to shield. However, you should obviously follow all the usual social distancing guidelines and wash your hands, as we all are. So people with osteoarthritis don't need to shield, and again, unless they have one of the conditions that might make them vulnerable.
Assuming I am a reasonably fit and healthy 80-year-old, does the COVID-19 virus have any impact on my arthritis? Or does arthritis affect the way the virus attacks the body?
Having osteoarthritis doesn't affect the way that the virus attacks the body, because it is a virus that attacks the lungs mainly. Having a reserve of fitness and muscle strength is very likely to be, to some extent, protective if you catch the virus. So it's great that you're fit and 80. And then the next part of that question was about, does the virus, what happens to you if you catch the virus? So catching the virus shouldn't affect your osteoarthritis or rheumatoid arthritis in any way, although fatigue and muscle and joint aching can definitely be a feature afterwards, and we're likely to be seeing a lot more of that in the future.
Has there been any thought on whether antibody tests will be accurate for RA patients, as many of our drugs mask inflammatory response? Also, is there any risk of COVID-19 recurring for people living with arthritis due to immunosuppression?
Those are really, really good and important questions. So I don't think anyone really knows the answers yet, because all of this is uncharted waters. However, COVID is a virus and is most similar in terms of the immune response to seasonal flu, to which we're all exposed every year. And you're quite right that people who are on certain medicines, especially one called rituximab, which is used for rheumatoid arthritis, don't respond as well to the seasonal flu vaccine as other people do. They do respond, but not in quite such an effective way. Most people on other immunosuppressing drugs will respond normally to the vaccine. The tricky thing with this virus is that it's likely to change its shape or its structure like the flu virus does. And so we're going to need to generate, once we've actually got a vaccine, it's likely that we'll need to create a new vaccine every year, like we do with the annual flu vaccine, which is slightly different year on year. The next part of that question was about COVID, can it recur? So we do not know if it can recur in people who are not immunosuppressed or people who are immunosuppressed. Although if you have mounted a response to the virus, that isn't likely, as long as the virus is the same and hasn't changed. So difficult questions, but hopefully if you've had the virus, you will develop an immune response, and then you will, at least for a while, become immune to that virus.
Okay, thank you. So we'll now move to cover a few questions related to work and arthritis, and this is very relevant since people are now heading back to work. Should I tell my employer that I have arthritis?
Yeah, that's a good question. So you don't have to tell your employer that you have arthritis. It's completely up to you. However, it's always a good idea to share your health issues with your employer, because they are duty bound by law to make reasonable adjustments to help you at work, to change your circumstances if necessary. So of course you don't need to tell them, but surprisingly they can often be really, really supportive if you do, if you share that, and obviously what you share has to remain confidential.
Mm-hmm. Mm-hmm. And we now have two questions about the safety of returning to work. So the first one is it safe for me to go back to work knowing that I have arthritis? And the second one is, I am a secondary school teacher on sulfasalazine and methotrexate. I work in London and use public transport. How at risk am I?
Well done for those names.
Love those drug names.
That was good. So having arthritis on its own doesn't mean that you can't go back to work, provided the environment is safe and that travelling there can be safe. So feel free, working is fine. All of our employers are going to be making adjustments so that social distancing is possible. And obviously now if we're going back to public transport, we all have to work and travel safely in line with the government's guidelines regarding social distancing and wearing face coverings on public transport. So now the next question about being on sulfasalazine and methotrexate is an interesting one. So hospital staff who are on two drugs are being advised to avoid direct patient contact, and because this means that you will be at increased risk of COVID-related complications and technically in the vulnerable group. So you should probably be avoiding indoor contact with others for now, but obviously this depends on what the guidelines are saying. I think to some extent, if you're working at a school, it depends how far away you can remain from other people. Obviously working with little children is much more of a risk than working with secondary school children. So I think you just need to be cautious with that and watch the guidelines, and provided you can keep your distance, then it's likely to be safe.
Thank you. We now have a number of questions concerning arthritis medication, treatments, and vaccines in relation to COVID-19. I have rheumatoid arthritis and take several medicines. Do I need to be completely isolating myself?
So we've covered this slightly already. So shielding advice was reviewed on the 31st of May and is currently in position up to the end of June. In Scotland, interestingly, they've already extended their advice to the end of July, and that their advice remains the same. So at the start of this, people who were vulnerable will have received a letter in the post from their rheumatology department or from their GP. And they were advised to completely self-shield at home and not go out even for shopping or medical appointments. And that advice also applied to their families and carers. Now, since the 31st of May, the advice has been a bit less restrictive, and people should continue to take precautions, but can now go out with members of their own family and spend some time with one other person outdoors, providing you're maintaining your social distancing. And that it's recommended that should be the same person every time. That makes sense, rather than 20 different people, of course. And of course, the advice on washing your hands and staying away from people who are unwell, including people who have a temperature or are coughing or have lost their taste of sense of smell. It's common sense, really. Of course, you don't have to go out if you don't want, and lots of my patients are certainly saying they're feeling very nervous about going out still, which is of course absolutely fine, and don't feel under any pressure to go out if you don't want to, or if you don't feel comfortable. So I think the advice really is just to keep an eye on our website and just continue to remain cautious, I think. So we are going to be updating advice as soon as it becomes available. So watch this space.
Thank you. Should I stop taking my immunosuppressive medicines?
The general advice is definitely not, no. People with active arthritis are at much higher risk of contracting infections in the first place. So it's much better to stay on your medication if your arthritis is well controlled. It's much safer. If you stop your medicines, the other problem is that your arthritis might flare, and that might mean you need to be put on steroid medicines temporarily, and these are much more immunosuppressing than drugs like methotrexate or sulfasalazine. So broadly, no, you shouldn't stop your medicines. Now, the most important thing to say regarding that is if you're on steroid medicines, you should never stop them very suddenly, because you could become quite unwell. If you are unlucky enough to contract the virus, then you should seek advice, but the advice at that point is generally you should stop your immunosuppressing medicines at that point. Phone your doctor if you're not sure what to do, or your rheumatology appointment, but again, don't stop your steroids.
As the biological drugs suppress the immune system and the virus makes the immune system overactive, shouldn't one cancel out the other?
That's a really good question, and that might in fact prove to be true in some way, but it's a challenging question because nobody, not even immunology experts, understand the immune system very well, and this is a new virus that we don't understand. So diseases, an interesting thing here is that diseases like flu and COVID can be fatal. They're dangerous because they cause something called a cytokine storm, And cytokines are chemicals that are present in our body naturally in very small amounts. But the problem is with COVID, lots of cytokines can be produced in the lungs, and that can be why it can be so dangerous. In rheumatology, we use lots of drugs that can inhibit cytokines, especially biologic drugs. And so that's why they are trialing some of these drugs for use in people who have severe COVID in intensive care, for example. One of them is called tocilizumab, and some of you might be already taking that drug, and that is showing some promising results for people who have COVID. You will have heard of lots of other drugs that are being trialed. So one called hydroxychloroquine that Donald Trump is famously taking, and that the trial for that drug has actually been stopped this week because it's shown to be ineffective and potentially dangerous. So hopefully he's stopped that medication, because that certainly doesn't work. And also, interestingly, this week you will have heard and read about a drug called Dexamethasone, which is a form of injectable steroid that has shown some really promising results for people who are on ventilators, shown to significantly reduce mortality. And it's likely that the steroids do that by affecting this immune cytokine storm that the virus provokes. So there's lots of promising things going on out there. And I think the answer to your question is maybe biologics may well help cancel out the COVID. And as things settle and we get more evidence, then we will know.
Thank you. I'm taking several types of medication, but none of them are immunosuppressants. Should I stop taking these?
No, definitely not. There's no reason to stop any medicines, other medicines at all.
How should I arrange to get my medication if I am shielding and not leaving the house?
So we have really upped our game, I think, in the NHS, and we've embraced all sorts of technology, and most GP surgeries and pharmacies can arrange to deliver directly to your house. Even my hospital pharmacy is delivering medicines to people's house if they need it, and they are, if that isn't possible, they are arranging safe pickup points. So that's been pretty straightforward for most people. So just phone your surgery and they will usually be quite helpful.
Should I stop taking NSAIDs such as ibuprofen?
Yep, that's another great question. So you will remember at the beginning of the COVID crisis, there were reports in France that COVID might be affected adversely by people taking ibuprofen and other anti-inflammatories. So in France, these were immediately stopped. Experts have looked at the evidence for this, and there isn't really anything conclusive. So NICE what they have suggested is that for patients who develop COVID, anti-inflammatories should be stopped. Where possible in advance, anti-inflammatories are replaced by paracetamol, but for people who need anti-inflammatories, for example, those with arthritis, they should continue taking them as normal.
I need to have blood tests regularly because I take Methotrexate. What should I do?
Okay, so most people who are stable on Methotrexate and other drugs that require regular blood test monitoring can have their blood tests extended, and you may well remember the olden days of doing it monthly, which has recently become 3 monthly, and we are extending that to somewhere between 4 and 6 monthly, providing things have been stable. If your blood tests have not been stable, then you will be advised to continue the same frequency, and you can often book an appointment rather than joining the queue of the masses to have a blood test. And the other thing is some surgeries are sending out district nurses to people's homes, so you will still be able to have your blood test. Some people are being switched to a different and safer form of medication. So just again, phone up and get some advice if you're not sure what to do.
Thank you. I have AIH and am immunosuppressed on azathioprine for over 10 years now, but also have osteoporosis. Early in March, I had a cortisone injection into the shoulder for the first time. I know immunosuppressants make me more vulnerable to infections, but what are the guidelines for cortisone injections? On top of that, how long should the relief last? And what are the long-term effects?
Okay, so that's a complicated question. So AIH stands for autoimmune hepatitis. That's the type of immune condition that's treated with immunosuppressing drugs. Now, the main thrust of that question was about steroid injections into the joint and whether these are immunosuppressing or not. And at the moment, some surgeons, and in fact, the X-ray department of our hospital have stopped doing steroid injections for this very reason, because of concern that they might be immunosuppressing. But we've looked at the evidence, and there really is no evidence that these steroids given by tiny amounts into the joints are immunosuppressing in any way. A very, very small amount will get into the blood. However, lots of departments are not doing these injections at the moment because they're not generally considered emergency or life-saving. So there has been a delay in these injections being picked up again. Now, the next part of that question was about how long should an injection last, and that is a piece of string, unfortunately. So sometimes they don't last at all, and sometimes the steroid injection can last for months or even years, or even cure the problem completely. So it's very, very variable. And then the last part of the question was about adverse effects, long-term effects of steroids injections. The immediate risk of steroid injection, the most important one, is a 1 in 15,000 risk, a tiny risk, but still a risk of causing a joint infection inside the joint, which is a serious condition, but the risk is small. There is a small amount of evidence suggesting that repeated injections into the joint can or may harm the cartilage of the joint. So in other words, may speed up the damage that's happening in the joints. But that's why most departments limit injections to a certain number for any individual joint. So hopefully that's answered all those sections.
Thank you. Would patients on Methotrexate be eligible for the COVID-19 vaccine?
Yes, hopefully, as soon as the vaccine comes through, it's likely that healthcare workers, especially those on the front line, will be offered the vaccination first, as they are already, to try to prevent it from spreading. And people who are already having the annual influenza vaccine, like people on Methotrexate, will be front of the queue, hopefully, to receive the new COVID vaccine when it comes, hopefully.
We now have a couple of questions about surgery and arthritis during the COVID-19 pandemic. So the first one is, due to the COVID pandemic, my hip replacement operation has been postponed. I am desperate for this operation, and I'm also experiencing a lot of pain in my arms and shoulder joints, which now need attention and x-rays with a view to potential replacement. I want to know what sort of priority level this treatment is given. How likely is it that I will receive the attention that is needed, i.e. a new hip and an appointment to discuss a shoulder with a specialist? I'm reluctant to speak to my GP as I know they are under pressure right now. I'd like to approach my GP at the best time to attain the best outcome and not waste his time.
Okay, so I know that this person is a young person, because having a hip replacement around the age of 40 is something unusual, and I guess that this is someone who's had arthritis from an early age. Now, the problem that surgical services have is obviously that 3 months of routine surgery has virtually been postponed. And although things are gradually picking up now and operations are starting to resume, because of the precautions that need to be taken to make sure people don't have COVID and make sure the operating theatre is cleaned really thoroughly between each person, then the surgery is going to be slow to pick up. So the waiting lists are likely to increase significantly. And I'm sure that everybody understands that the NHS has to prioritise emergency work over what would be considered routine surgery, although this is clearly not routine for people in pain. They have to prioritise trauma surgery and cancer surgery ahead of routine surgery. However, pain is obviously an issue, and that needs to be sorted out. Now, don't feel guilty about speaking to your GP. That is absolutely 100% why they are there, and they want to help. So please call your GP, and then they're in a really strong position to be able to give you some advice on pain management. The other thing your GP can do is to lobby on your behalf. Not a delay in surgery will not damage the joints, but clearly you want to get back to work and get back to functioning. So to me, that should be a priority. If you are familiar with the surgeons that are going to be doing your surgery, it may well be worth trying to contact them directly through their secretaries, because they will be aware of your particular case and can help you as well. So your GP can help write to the surgeons, and you can hopefully try and contact the surgeons directly. Please do it, because they've obviously got thousands of patients, and they need to know who's in trouble, and unless you let them know, they won't know. So please push.
Thank you. I was due to have an arthroscopy of my wrist after fracture last year, but this was cancelled due to the lockdown. When a new date arrives, is there a greater risk to COVID-19 after surgery?
No, there's absolutely no reason to think that people will be more at risk of COVID after surgery, especially if that's done with a local anaesthetic. All of the instruments and tools and things will obviously be disposable, and everything will be super. It's always super clean, but it will be even more clean than it was before, if that's possible. In addition, everyone coming into hospital will be swabbed, as they currently are for MRSA. Everyone will be swabbed for COVID before, during, after their admission. So don't be frightened.
Next up, we have a number of questions around how COVID-19 can affect self-management of arthritis, including things like exercise, diet, and mental well-being. The first question is, do you have any recommendations for managing joint pain without leaving the house?
Yeah, definitely. All of the advice that we're going to be giving now on self-management is obviously available on our website, and there's loads of new things up there to see if you haven't seen them. So what you can see now is that it is the front page. So there's all sorts of new stuff there, which is really helpful. So if you've got pain, it's often can be, if you've got arthritis, you'll know what it's like. The pain is up and it's down. So first of all, temporarily increase your painkillers. I know I would say that being a doctor, wouldn't I? But that's often a good thing, and don't panic. First aid, so applying ice can be really helpful, elevating the affected joints, and then resting at that particular joint if you've got one particularly bad one. Distraction and mental first aid we're going to be talking about in a little while, and stay mobile exercise we're going to talk about a bit later as well.
How should I change my diet if I'm not leaving the house as much?
That's a really good question, and I hear that certain biscuit companies are doing particularly well at the moment, so I'm guessing it's a challenge for all of us. So if you're doing less physical activity than normal, which most of us are, then clearly if you're eating the same amount as you were before, then you're going to gain some weight. So you're going to have to be extra careful with what you're eating, and just be really careful. Lots of us are comfort eaters. Lots of us reach for the biscuits, and I eat standing up, which is really bad. So think about healthy eating. Martin has produced lots of interesting stuff on the website to do with diet, especially to do with vitamin D. I'll talk about that in a second. So trying to concentrate on eating healthily. It will never hurt any of us to eat more fruit and veg. Try not to eat between meals, and try not to have too many snacks or crisps in. Increase the amount of fibre you're taking, so that can help us stay full, and drink plenty of water. Now, the next thing that we're all doing is probably drinking a bit too much alcohol. So try, if you can, to have some alcohol-free days, because alcohol's got a lot of calories, and it's easy to consume a lot more than you think you are just by drinking a little bit more. So if you're not going outdoors at all, which is most of us, well, at least to some extent, most of the day, then we should try and make sure we're getting enough vitamin D, and that can be bought easily and cheaply over the counter. then the alternative is if we're eating a bit more, we can always try exercising a bit more indoors, and then we'll hopefully stick to a healthy weight. So we'll talk about that in a little while.
All excellent tips on this very rainy
Yeah.
day. How can I remain active and healthy if I'm not allowed to go outside?
Okay, so it's completely possible, and lots of people have transformed their lives and are fitter than they ever have been, which is a miracle. Most of us are not, but it's completely possible to exercise just as much as we used to in the home, and do exactly as we did even down the gym. So remember, exercise can't harm the joints. So even if they're hurting, you're not doing yourself any damage. Exercise has got a really important anti-inflammatory effect, and exercise can help relieve pain as much as codeine and some other strong painkillers. So be strong. You can do it. So almost anything that you can do at the gym can be done at home using your own body weight or simple household things that we've all got. Even tiny amounts of exercise, a minute or 2 minutes or 5 minutes, can make a massive difference to how we're feeling, both physically and mentally. More later.
Yeah. I'm struggling to cope without my usual routine of physical therapy. What advice would you give me to help?
Yeah, so obviously lots of physiotherapy departments have completely shut down, but although they're starting to pick up again now, and physiotherapists too are embracing doing consultations online and giving exercises online. So don't lose heart. Keep phoning if you're waiting for a physiotherapy appointment, because they're starting to pick up again now. So if you're going it alone, what you're going to be aiming for with your exercise is a combination of aerobic exercise, so that's to be slightly out of breath. That's for cardiovascular fitness. We should all be trying to do some strength training, in other words, some form of weightlifting. It's not as scary as it sounds, or working against our body weight. Then we should also be doing some gentle stretching and working on our balance. So on our website, first of all, we've got a great series of little moving video things that are going to be shown now. So chair-based exercises. So we've got some great little moving images there. And we've also got a directory with lots of information about free online exercise classes that are running during the pandemic. There's absolutely loads of these things online. So there is sitting yoga, there is sitting Tai Chi, there is Joe Wicks. Do not attempt the very serious Joe Wicks because you will be exhausted. However, there's some very easy Joe Wicks. So there is Joe Wicks for older people, and there is Joe Wicks for people who've got particular problems with their knees. So I've certainly met some people who've done those after surgery, and they've been completely bearable. So try exercising to music. Practice standing from sitting. If you're very unfit, just something simple like that can be really helpful. Doing some very gentle small squats can really help keep your muscle strength up. And then balance is really important for us all. So a really simple thing to do can be when we're brushing our teeth, practice standing on one leg and then stand on the other, and we're all aiming to be able to do 30 seconds on each leg. If you're really good at balance, then you can try shutting your eyes, but obviously make sure you've got something to hold on to. Please don't fall over. So there's absolutely loads of things you can do. Lifting small cans of weights above your head, or if you get good at those, fill a litre bottle with water, and a litre weighs a kilogram. So that could be well worth doing for your arms. And obviously things like those stretchy elastic bands can be really good as well for working your legs, and you can buy those online. So there's loads you can do. Don't lose heart.
My pre-existing problems with anxiety and depression have been made even worse during lockdown. As I am in the shielding category, what exercise regime do you recommend that would improve both my mental health and stop me from stiffening up completely?
Okay, thank you for that. Really, those are really great questions. So we've already covered the physical things a little bit, and the good news about exercise is that even a little bit of exercise, even 15 minutes of gentle exercise, has been shown to significantly improve mental health. Now, Your question covers the really important issue of mental health, and I think it's probably fair to say that all of us have felt a bit wobbly at some time or another during this crisis. So lots of us are feeling very anxious, and lots of us are feeling a bit more low and nervous about going out. For example, this is completely normal. We're going through something very unexpected and very challenging. This, I don't think, has been helped by some of the media coverage, particularly at the beginning when the media were looking for a new story that was more sensational than the last, and that's made lots of people feel quite frightened about things. After an event like this, it has been estimated that many of us will suffer from temporary post-traumatic stress disorder, so that can be happening up to 60% of people after something like this. Most people will recover with simple self-help measures, but up to 10% of us may be affected more longer term by some of the things that we've seen and experienced and even heard about. So it's expected that there is an emerging mental health crisis that may be coming. So it's very important that we try and look after ourselves mentally as much as we can. Now, we have to speak about a mental health emergency. If anybody is feeling really low and is at risk of harming themselves, then medical services are absolutely 100% still there. Feeling low and feeling that life is not worth living remains a medical emergency, and you must get some help straight away. So you must phone your GP straight away, or you must go to your emergency department where help is available. So the Samaritans are also, of course, obviously out there. So if you're feeling very low, please make a plan for what you will do if you're starting to feel desperate, and write it down so you know what to do. And hopefully that won't apply to most people. So if you're just feeling a little bit low or a bit more blue than usual, then there's lots of self-help things that you can do to improve your mental well-being. And again, a lot of this advice is available on our website. So first of all, so there's lots of mental health resources available there. Now, one thing I found quite helpful at the beginning was to just stop listening to the news for a couple of days and stop reading about the numbers of people who had it or the numbers of people who died, and that certainly made it a bit more bearable. There's some really great books on self-care out there, and I can recommend two in particular. One by Matt Haig, who's written a really good book about his struggle with depression and survival from depression, called Reasons to Stay Alive. That's excellent. And then another one by a young woman called Maggie Van Eyck. With all of this information is online. And she's her book is called Remember This When You're Sad. And she's a young woman who went through a lot of anxiety when she was in her 20s. And she discovered a really nifty way to cope with this, which was to write down useful things that she'd found to comfort her when she was feeling anxious, however small it might be. Listening to the birds, listening to music, having a hot bath, writing a lot of lists of things that made her feel better when she was feeling low. And when we're feeling low, it's hard to remember these things. So writing lists can sometimes be helpful. So I recommend those two books. Now, so make lists for what's helped you in the past. Counting your blessings can be really helpful. So thinking about our friends, thinking about our family, thinking about comforting things, and the blessings that we have in our life can really, it sounds trivial or patronizing, but that can be a really, really powerful tool to help us when we're feeling really low. There's lots of support, practical support out there. So befrienders. So for example, Age UK have got a telephone befriending service. So if you feel like you want to chat to somebody, Age UK are a good place to go. The British Red Cross are also out there helping people and delivering food and all sorts of things. So there's masses of sources. The help local councils will have a list of all these things too. So refer to our positive wellbeing page, which will be excellent. Personally, I've found meditation really helpful through Headspace. There's lots of apps out there, but Headspace has been really good. They've got very short and free meditations that you can try anywhere between 3 and 10 minutes, so you don't have to do it for ages and ages. Mindfulness, or being aware of the now, listening to your breathing, listening to the birds, listening to your steps when you're out walking. All of these things can help to ground us in the now. Learning some breathing exercises can be really helpful. So what we thought we'd do was to attempt a bit of a breathing exercise now, just to show you one. I've discovered it's difficult to talk and breathe and concentrate all at the same time. So we're gonna give it a go. So if you're trying, first of all, I hope you're sitting down. Sit yourself down comfortably. And the first thing we're going to do is to take a deep breath in, and in through our nose and out through our mouth, just to get ourselves started. So a nice deep breath in, and a nice deep breath out through your mouth, sighing if you want. And the next thing we're going to do, keep yourself comfortable, and we're going to close our eyes, and then we're going to breathe in through our nose for approximately for the count of 4. Then we're going to hold our breath for about a count of 4, and then we're going to do a longer breath out for a count of about 8. So I'll just demonstrate now. So first of all, close your eyes, breathe in through your nose for the count of 4, hold it for about 4, and then breathe out slowly through your mouth for the count of about 8. So in through your nose, hold it, and then out slowly. Okay, so everything's gone a bit quiet now. So I hope you joined in that. So if you're feeling really anxious or stressed, that can just help ground you. Just do that a few times, or whenever you need. Now, the next thing that can really help, if you're feeling very anxious or feeling low, is distraction. This is one of the most powerful things. So lots of people, even loneliness can be really helped by distraction. And loneliness it's not necessarily a constant state. It can go in flux up and down. So distract yourself by doing a puzzle, listening to some music, relaxing, reading, learning a new skill. Anything that you can do to distract yourself can often get you out of feeling a bit low. If you achieve something good, however small, if you make a great cake, if you walk up and down the stairs twice, pat yourself on the back and congratulate yourself for getting through another day and doing something good. And then the final thing is doing a kindness for somebody else. So studies have shown that people who help others, for example, concentration camp survivors who helped each other, were more likely to survive than those who were perhaps not as able to help others. So helping others can be a really, really powerful thing to help with our mood. So remember, you're not alone. There's loads of resources online and lots of help out there for you.
Thanks, Wendy. I feel so relaxed after 3 deep breaths. It's amazing. I'll just mention too that we've moved all of our group meetings to virtual meetings. So if you are in an area of the country that you weren't attending groups, you are very welcome to join our virtual groups if it would be helpful for mental well-being and just some company to speak to other members of Arthritis Action and the general public. Or our team are on the phone. You can give us a call anytime if you would also like to speak to somebody during the day. We'll now spend some time. Oh, that's the end of the questions. That's great. And I can see we have many, many questions already in the Q&A box, which is fantastic. So we have approximately 10 minutes to answer some of these questions. Again, a reminder, if the questions come up that you've been thinking about, you can type that into the Q&A box now and we'll have a look. I don't think we'll be able to get to all 17 questions that are up there at the moment, but again, we'll be sure to get back to you if we aren't able to answer them all in the next 10 minutes. So I'll pass over to Wendy to have a look at the questions and
Okay, great. So Jack, yes, I know you're there. There's a couple of questions there about rituximab, and rituximab is a drug for rheumatoid arthritis, and it's got a very long duration of action, approximately 6 months or even more in some people, so which is potentially immunosuppressing people for 6 months. So many departments are suggesting that people postpone the rituximab until this is over, if this is possible, or switch to a different form of biologic if that is at all possible. So if you are on rituximab and your joints are flaring, please contact your department because they will have a strategy especially for you. There's a question there. If someone has only recently started biologics, Should they shield or can they return to work? The answer to that question is it depends if your arthritis is still active. If your arthritis is under good control and you can maintain social distancing, then it is probably safe for you to go back to work. But if your arthritis is still active, then it may well be best for you to not return to work if that is possible. Right, let me just go through some of these questions. There's a question there. I have been put on Naspren tablets. I think that's naproxen tablets for my flare-up. Shall I still take omeprazole tablets with it? I used to take ibuprofen, but my flare-ups increased and they changed my medication. Okay, so that's a good question. Both of those tablets, naproxen and ibuprofen, are anti-inflammatory tablets. And as we discussed earlier, if you need those tablets, you should continue taking them. Both of them can harm the stomach. So omeprazole is something called a proton pump inhibitor, which is used with anti-inflammatories to protect the stomach. So if you have stomach problems, it's recommended that you should definitely take all of those things at the same time. So there's a couple of questions there about people who've had their rheumatology appointment cancelled. So, for example, here, I seem to have had my assessment consultation cancelled. How can I get back into the system to obtain an appointment as soon as possible, please? So I'm guessing that's either rheumatology or orthopedics potentially there. So I think that if it's been it shouldn't have been cancelled. It might have been postponed, but it shouldn't have been cancelled. There'll be a telephone number that you can initially use at the top of that letter that you can try to use to clarify what's happening with your appointments. If your rheumatology appointment has been postponed and you are in need of some help, then please phone the advice line, which is still running, as I said, for most departments. If you can't get through on the advice line, then you can definitely phone the rheumatology department. The secretaries are definitely still working, and they might be working remotely, so it's worth phoning the secretaries of the rheumatology department or the orthopedic department, whichever one you need. Failing that, if you can't get through on that line, then please contact your GP, and then they will have a way of contacting your department electronically or by phone. There will still be doctors available on call, and they can most definitely expedite your appointment for you or attempt to expedite your appointment for you. Anyone having an emergency will still be seen, so fear not. Okay, let's have a look at some of these other questions. There's a question here. Is adult onset Still's disease in the category that must shield? I am on weekly methotrexate but no other drugs. My GP has added me to the list for shielding, and I know others via Facebook that are in the same position, and some have been put into shielding and others that haven't. Yes, that's a good question. If your arthritis is stable and you are on just methotrexate, then the best guidance comes from the British Society for Rheumatology. I agree that there's been quite a lot of confusion about this, and hospital departments have written to everybody who needs to completely shield. However, some patients in addition who we would not consider need to shield have had letters from the GP suggesting that they do as well. So what I suggest you do is go to the British Society for Rheumatology website and look at the risk stratification guidelines on that. There's a question here about pain management and anaesthetist appointments that have been postponed. This is a difficult one because all anaesthetists that I know of have been seconded for the foreseeable future to be doing other duties, COVID-related duties, and your GP can try to put some pressure on, but at the moment, the pain, as far as I'm concerned, in our hospital at least, the pain management services have been suspended for the foreseeable future, although we're hoping that they will start to pick up again soon. What else have we got here? Jack says ENT at Southend Hospital seem to have shut down. Couldn't comment on ENT. Sorry, that may be the case, but they're still doing. They will still be doing emergencies. Another question here. I have osteoporosis after 30 broken bones. I've been told to walk daily. The physio suggested about 7 miles daily. I've done this for 13 weeks. My osteoarthritis has taken off. Oh dear. Pain in hips, feet, and elsewhere. The doctors are not seeing patients, and I was given Robaxin 750 milligrams. I'm guessing that's an anti-inflammatory. I'm not completely sure. So that's a tricky one. With osteoporosis, you do need to be doing weight-bearing exercise. The more you do, the stronger your bones will be. You don't necessarily have to walk that distance, but things like marching on the spot or stamping up and down can be very helpful. The Royal Osteoporosis Society website has got some really good advice on exercising with osteoporosis. So the main thrust of your question is to do with your arthritis pain. So I hope I might have said something that helped you with that. All the self-help measures will apply. It may just be that 7 miles a day is a bit too much for you. That is quite a lot of exercise. So just take it slowly, I would say, and exercise within your means. So don't go mad, but try and do what you can. Okay, so a question from Sue. Can I confirm that if you are in pain from a flare-up, it's recommended to exercise? I do yoga, which can mean a lot of work on the wrists and hands, which for me can be really, really painful. That is a good question. It sort of depends on what sort of arthritis you have and how much swelling you have in individual joints. So if you've got a really painful, very swollen joint, it's not a good idea to be doing too much exercise with that joint. And first aid like ice and resting would be a good idea. Clearly, when you start to exercise, it's normal to get a little bit of aching, and in general, the advice will be to try and work through that pain if you can, if it's just general aches and pains. It is possible to do a lot of the yoga poses without using your wrists and hands. So even a downward dog can be done with flattish wrists that don't cause too much strain on the wrists, or you can do similar postures to that kind of downward dog with not on your hands and feet, but with your arms outstretched and resting on a shelf or something like that. So you can work around that if you're doing the right exercise. So it's a difficult question, a difficult one, that, but in general, keep moving, because that will often help the joints. Right, what else have we got? That might be almost all there's a couple more questions there. There's some quite long questions there. Down there, it took some of one. I think I've answered most of the questions there, Shan.
Excellent, and we can get back to anyone. We are starting to run out of time here, so we'll be sure to get back to anyone if we didn't get to your question. But hopefully Wendy answered some of them as we went along as well.
Yes, definitely.
Yeah, so thank you so much, Wendy. We really appreciate your time. This concludes our webinar on COVID-19 and arthritis. If you'd like more information on arthritis, please visit our website at arthritisaction.co.uk. We have a dedicated advice page on COVID-19, including information on exercises, dietary information, well-being resources, and tips on staying connected. So many of the pages that we showed you today, and we'll be sure to send the links around as we go. The video from this webinar today will be available shortly on our YouTube channel, so we will also send an email out to you with the link for the recording once it's available, just in case you'd like to watch it again. All that's left now is for me to say a big thank you to you, Dr. Wendy Holden, for answering all of the questions today. And thank you to all of you for coming along and joining us at this webinar.